Few diseases frightened parents more in the early part of the 20th century than polio. It was known as the world's most feared disease. It struck in the warm summer months, sweeping through towns in epidemics every few years. At its peak in the 1940s and 50s, polio would paralyze or kill over 500,000 people worldwide every year. Although major polio epidemics were not recorded before the 20th century, the disease has caused paralysis and death for much of human history. Although most people recovered quickly from polio, some suffered temporary or permanent paralysis and even death. Many polio survivors were disabled for life. Polio is the common name for poliomyelitis, which comes from the Greek words for gray and marrow, referring to the spinal cord, and the suffix itis, meaning inflammation. For a long time, polio was called infantile paralysis, though it didn't only affect the young. There are 3 types of polio. The worst of the 3 is called paralytic polio, which shows up after an initial period of viral-like symptoms, typically with loss of superficial reflexes and muscle pain, or spasms. Paralysis, usually asymmetric, follows. Polio is a highly infectious illness and only infects humans. It is very contagious and spreads through person-to-person contact. It spreads through contact with the stool of an infected person and droplets from a sneeze or cough. An infected person may spread the virus to others immediately before and usually 1 to 2 weeks after developing symptoms. It can contaminate food and water when people do not wash their hands. The polio virus enters the body through the mouth, multiplying along the way to the digestive tract, where it further multiplies. Polio has no cure, so prevention is the most effective means to combat it.
It is a wicked disease, and it is a virus that attacks children and young adults in the prime of their life. And once they're infected, there's nothing that a doctor can do. We can't halt the progression of the disease, can't prevent the paralysis. There's nothing that can be done.
In severe cases of paralytic polio, the throat and chest may become paralyzed, so death may result if the patient doesn't receive artificial breathing support. That's why the iron lung was invented in 1928 to help patients survive. Polio left its victims marked for life, leaving behind vivid images of wheelchairs, crutches, leg braces, breathing devices, and deformed limbs. In 1921, President Franklin Delano Roosevelt became completely and permanently paralyzed from the waist down. He helped found the March of Dimes in 1938 to raise money for the rehabilitation of victims of paralytic polio. He was also instrumental in funding the development of polio vaccines. The first polio vaccine was announced by Dr. Jonas Salk in 1953. Dr. Albert Sabin developed the oral polio vaccine in the early 1960s. Mass immunizations were launched in 1957 and promoted by the March of Dimes. Polio survivors are one of the largest disabled groups in the world. Many polio survivors suffer post-polio syndrome later in life. By 1961, only 161 cases were reported in the United States. Healthcare providers in the United States no longer administered the oral or live polio vaccine. They instead administered the inactive polio vaccine. Thanks to this effective vaccine, the United States has been polio-free since 1979. But the polio virus is still a threat in some countries, and that's why it's so important to have your children vaccinated.
And as long as polio exists in other countries, unvaccinated people in the United States are going to be susceptible. And if that polio virus makes it across the ocean, then it will find a home in children who are too young to have received the vaccine and in children who never received the vaccine. So it's very important until this disease is eradicated from the world to continue to maintain our immunity here at home.
Even if you were previously vaccinated, you may need a one-time booster shot before you travel anywhere that could put you at risk of contacting polio. For the best protection, children should get 4 doses of polio vaccine. It is given as a shot in the arm or leg and is extremely safe. Your child should receive a dose at age 2 months, 4 months, 6 months, and then a booster dose at between 4 to 6 years of age.
Well, what I tell parents to do is that you love your children so much that the fear that something will happen to them overcomes you. And what you need to do is not work to your fear, you need to get the facts. So if you're uncomfortable about a vaccine, I would read and find out. If you get all the facts, then I think you'll make the same decision that the public health people have recommended.
The only way to protect your family from polio is to vaccinate. Ask your healthcare professional today about vaccinations your children should receive.